Good morning. I'm Dr. Christine Rankin, back from South Metro Wellness Clinic. We took a couple weeks break because it's been an interesting and busy couple of weeks, so we're excited to be back today. We're going to change things up and be a little bit more refreshing, and so I wanted to give everybody a chance to see what the examination process is like when you come in as a new patient. So, welcome to my practice. Come on. All right. As I walk new patients back here, I make a quick reference here as to our adjusting tables. You guys may not have actually seen these yet. We've always been in the office. So this is where all of my adjusting occurs. We see a couple people at a time. We schedule 3 patients every 15 minutes during our adjusting shift. Back here we have our therapy bay. Nice relaxing area, as well as Dave's favorite, the massage chair. In Angel's room, we'll go over that another day, but hers is right back here. So before we come into the exam room, we always knock. Least though, of course, no one's going to be back here, right? Because this is a free day. Come on in. Give you guys an example of what our examination looks like when we begin. So as a patient, when you're going to come in, we're going to ask you a few questions about your health. You will have already filled out the paperwork. And during the consultation, which we can do either in the office or a mini consultation back here, depending on how severe the problem is, we start with the consultation and then go right into the exam. There are 3 pieces to every exam. It depends on what you're coming in with. Auto accident injuries and workers' compensation injuries are going to be more of a tier 3, where there's going to be a lot more information that needs to be collected and a lot more detail. If you're coming in for a wellness check, you're going to be at a level 1. Everybody else is somewhere in between. So before we get started, we start with a blood pressure. Okay, a blood pressure reading lets me know a lot about who you are. If your blood pressure is normal, if it's a good quality normal for you, that's a good clue. A lot of people's blood pressure is higher if they're in pain or if they're coming in and they're just terrified. Very terrifying. I don't wear a white coat, but still some people suffer from nerves and white coat syndrome, so we just go ahead and document that as we go through here. We enter everybody in as a brand new patient. This is an example of a muscle scan. But one of the first things that we do is gown up. Better make a reference to that here real quickly. I can't examine anybody without proper attire, right? So almost everybody needs to wear the gown. This beautiful, amazing thing. You'll need to remove most of your clothing from the waist up, because I'll need to see your skin on your back, your shoulders, and the back of your neck, and sometimes arms. And if you need to have feet examined or something else, a gowning is always done appropriate to the exam level. It opens to the back, okay, and then you'll have a seat right here in the middle, and then we will begin the rest of the exam. Go ahead and put this guy back here. All right. So the first portion is a muscle scan and a nerve scan. So I'm looking for damage in muscles, soft tissues, also nerves, and a good quality picture of observation. What does your posture tell me? What does your gait tell me? What does your balance say about you? And how does that correlate to the problem that you're experiencing? We go ahead and complete the exam. The red is for the left, the blue is for the right. They go on either side of the soft tissue of the bones in your back. Okay. We start from the hairline, we end right here at the belt line. Okay. The computer shows me a colored barcode, which explains to me how much inflammation, what kinds of patterns of inflammation, and what type you have, and where it's located. And then we go ahead and correlate that with your other exam findings. Once that portion is complete, level 2, and I'm going to move the gown here just a little bit so you guys can see. These are Thomas tables. They move up and down. So they're not electronic. They don't come up and down. I prefer to use very simple equipment. I'm very, very dexterous. I guess, what's the word for that? Hands-on. Very kinesthetic, and very, very simple. I'm actually a very simple doctor. I believe in the most traditional techniques out there because they work, and they work the best if you do them consistently. The table comes up and down. Okay, depending on what position we need to have you in. Okay, and that's pretty much it. Orthopedic tests, range of motion are done seated, standing, and in the prone position, which is face down. Once the orthopedic testing is complete, we look at lumbar range of motion. We also do heel walk, toe walk, and sometimes a postural analysis that's a little bit more in depth, or a gait analysis, followed up with more questions to help determine what kind of treatment is going to be right for you. Those are pretty much the basics. After your examination is complete, we finish the consultation. Any other Q&A that needs to happen, or addressing any concerns from you as the patient as to how your treatment is going to go, then everybody gets a complimentary therapy out here, either in the muscle stimulation or the massage therapy chair. The chair goes for 15 minutes. The therapy goes for 10, I believe, off the top of my head, as well as a hot pack, cold pack, if necessary or desired. And then we go ahead and check out, furthermore, answer any additional questions. And that pretty much completes most of the examination and consultation process. If it is an emergency, yes, there is treatment available on day one if you were injured in a serious car accident, or you're coming in with an emergency and you just don't think you can walk. We have had people last winter who came in and could not walk. They got an emergency adjustment, but traditionally on day one, we focus on collecting all of the information first. I want to know who you are. I want to know how to treat you appropriately. And then we follow up with what's called Report de Médico, if you're a Spanish speaker, or a report of findings. Okay. And yes, for my Spanish speakers, everything is conducted in Spanish. Don't kid yourself. We have a lot of those people in here now, as well as their report of findings. So basically, the report of findings is part of the examination portion. It's part of your new patient experience, okay? We have to go over, if you're using insurance, how the insurance company is going to serve or not serve in a chiropractic setting, as well as how many times a week you're going to need to be seen, what type of treatment we're going to provide for you. There are no contracts typically, and so basically, if there's anything that's not going well, you're free to pursue treatment in another area without consequence, and you'll never have any question from any of us here. We want what's best for you. If there's any time I'm not earning someone's business, I will not take their time or their resources from them. I just don't believe that that's fair. And so once we go through and decide what kind of treatment is going to be right for you, the examination is very private, and also the report of findings is very private. We spend typically 20 minutes, just the two of us together, deciding what's going to be right for you. The reason we spend the time up front and do all of the work beforehand is to enhance your results and make them more successful and get you the health and healing that you're looking for in a shorter amount of time. And the only way to achieve that is by doing the work and the research up front and getting to know you. I've been in practice for 9 years now. I do adjust very, very differently now than I did when I was fresh out of school. Treatment plans are much more condensed now. With the help of therapies and massage, we're able to get patients better results in a more timely fashion. So it typically is a higher return of investment with less time, which always makes everybody happy, especially me. So it's great to see people succeeding and doing well with their care. After your first number of visits is completed, we will come back and do another examination, which is a condensed or a shorter version of what we do on day one, to go ahead and check the results and make sure that you're getting the progress that you're looking to achieve. And we will alter treatment plan or the course of treatment plan if necessary at that time. So once again, Dr. Christine Rankin with South Metro Wellness Clinic. We're across the street here in Burnsville, across the street from Costco. Want to make sure that's very, very clear, because that's a fantastic anchor business. There's lots and lots of cars driving through here, open parking lot, but we're very, very easy to find. If you have any questions, our phone number is 952-892-5006. If you're not looking to get an examination, but just do a consultation, there's no charge for a phone call or just to come on in and just see if the practice would be right for you. Until then, I think that's all we have for today. We'll tune in next week with some more exciting information and some more information about kids and chiropractic via a request here from Iowa that I just received a couple weeks ago. So I haven't forgotten about you. We're going to go ahead and do that. Until then, stay safe, stay warm, and we'll see you next time.